Okay. Ready? So after finding out I'd be working with post-stroke adult clients this semester, I was eager to learn as much as possible about the adult population. I've also been interested in feeding and swallowing disorders after shadowing the NICU department. I decided to put the two together and do some research on a growing topic in the field of speech-language pathology. A stroke is a sudden interruption of blood supply to the brain. In 40 to 65% of stroke clients, dysphagia coexists. Dysphagia is difficulty swallowing foods or liquids. Although the prevalence decreases with time, 50% of patients still have dysphagia 6 months post-onset. Dysphagia increases risk of malnutrition, dehydration, and aspiration. I wanted to learn about the intervention and treatment options currently available to dysphagia clients and determine which option equals the best outcome. 2 intervention techniques that appeared during my research were 1, expiratory muscle strength training, or EMST, and 2, pharyngeal electrical stimulation, or PES. Expiratory muscle strength training is an emerging, low-cost motor exercise that employs increased resistance during inspiration and expiration using a pressure threshold device. Electrical stimulation involves the administration of small electrical impulses to swallowing muscles through electrodes that are in contact with the skin. To narrow my search options, I formulated my PICO. My question was, will adult patients with stroke-induced dysphagia have more of an improvement with their swallowing ability that use the traditional intervention of muscle strength training versus those who use electrical stimulation? I went on ASHA.org and within evidence maps, selected treatment, stroke, and dysphagia. This provided me with a number of systematic reviews, guidelines, and qualitative studies. I also found articles through the LSU-HSC Library Resource website, EBSCO, and Google Scholar. Databases such as Medline, Embase, and PubMed were frequently cited in my articles. I used a total of 7 articles. 4 focused on muscle strength training and 3 focused on electrical stimulation. Evidence-based practice, EBP, is any practice that relies on scientific evidence for guidance and decision-making. The articles used to conduct my research are evidence-based as they formed clinical questions and conducted research to generate data. I'm first going to discuss the information regarding EMST. Expiratory muscles play a vital role in communication and swallowing. Expiratory muscle weakness can be caused by central nervous system conditions such as stroke. Reduced muscle strength negatively impacts a person's ability to produce enough pressure for a cough, placing them at risk for aspiration. During the training, patients forcefully expire into a one-way spring-loaded valve. The pressure threshold device is adjusted incrementally to progressively increase resistance, referred to as progressive overload. The patient's practices generating sufficient expiratory pressure into the mouthpiece in hopes of increasing their muscle strength. In EMST, there is a prolonged activation of the suprahyoid muscle group, which include the digastric, stylohyoid, geniohyoid, and mylohyoid. These muscles are crucial in facilitating the swallow. In one article, it was stated that EMST has been shown to increase the efficacy of these muscles. In two of the reviews, a decrease in aspiration, determined using the PAS, or the pharyngeal aspiration scale, in both fluids and solids was noted after EMST. PAS is used to rate degree of aspiration observed during the activity of swallowing. A lower PAS is what we want to see. The EMST protocol is not standardized and varies in intensity and duration depending on the client. The number of sessions per week and how many weeks training lasts varied amongst all the studies in the articles, from 5 to 7 sessions a week and from 4 to 8 weeks in duration. It is portable, easy to use, requiring no assistance from a specialist. Overall, EMST proved to be a good training for clients with respiration, speech, intelligibility, and swallowing issues. There does need to be further research on the effect of EMST on swallowing and cough functions specifically, as this is an emerging treatment option. However, EMST should be a noted option by SLPs in regards to the management of dysphagia and airway protection. In comparison to EMST, pharyngeal electrical stimulation, or PES, is a more technologically advanced option, also has positive data in support of its effectiveness in treating dysphagia. There are 2 types. of electrical stimulation, pharyngeal and surface. Pharyngeal works to strengthen the weakened oropharyngeal musculature, and this is the one we'll be comparing. The pharyngeal electrical stimulation is best suited for clients who recently experienced a stroke. It also appears that those more likely to respond to the treatment are the more severe cases of dysphagia. However, for these acute and severe clients, it did reduce the patient's length of stay in hospital as well as reduced their aspiration. In one study consisting of 73 patients, those who were randomized to PES had significantly lower mean aspiration score by 2 weeks than those who did not receive PES. Although this is a small study and more research is needed to further support this claim, results were consistent amongst all the studies mentioned in this particular article. Supported by small studies with low number of clients, pharyngeal electrical stimulation has begun to show some positive results. However, appears most effective in the short term. Similar to muscle strength training, this treatment too requires much more research to determine if it individually can positively affect a patient's swallow ability. Although both interventions have positive data to support it in terms of long-term improvement, greater availability, and larger studies run to support it, the better intervention is the expiratory muscle strength training. It decreases aspiration, decreases dysphagia severity, and increases the efficacy of crucial swallowing muscles. Due to the extensive number of available online databases, compiling articles during my research was not difficult. This research is important for SLPs as well as any other medical professional who will be working with a client with feeding, swallowing, respiratory, speech, or voice disorders, as these functions are closely related and impact one another.